Now let's talk about the next fracture. So I'm sure you can see the wrist joint, AP view, lateral view, not in elbow is not seen, but I can see a significant part of the radius and ulna. So definitely there is a radius here which we all can see. There is a fracture of the radial shaft which we all can see. There is a fracture of the middle and distal 1/3 of the radial shaft that we all can see. So you do have a fracture. You have a fracture of the radial shaft at the junction of middle and distal 1/3, and then you have here, if you see, you have the distal radial nerve joint disruption. So here I can write down that this is the fracture of shaft of radius. Okay, fracture of the shaft of the radius, but particularly I have to tell you that this is at the junction of middle and distal 1/3. This is at the junction of middle and distal 1/3, and what you can see here is the drudge disruption. What you can see here is basically the drudge disruption, that is the distal radio-ulnar joint disruption. Alright, so you can see a distal radio-ulnar joint disruption. So this is a Galeazzi fracture, also called as reverse Montegia fracture, also called as Piedmont's fracture. So it's a Galeazzi, it's a reverse Montegia, it's a Piedmont. So Piedmont is the name of a place. The Orthopedic Society of Piedmont worked hard for this fracture, therefore we call it a Piedmont fracture. Now I would like to put it across that if we assume that this is a radius, and if we assume that we shift the fracture to ulna. So if we assume that this is a radius and we shift the fracture from the radius to ulna, and we do have a fracture of shaft of ulna, and we do have a fracture of shaft of ulna exactly at the junction of middle and distal 1/3, exactly at the junction of middle and distal 1/3. And apart from that, if you have the distal radio-ulnar joint disruption, apart from it you have the distal radio-ulnar joint disruption, then we call it a reverse Galeazzi or a Piedmont, or then you call it a reverse Galeazzi fracture or a reverse Piedmont fracture. So this is basically reverse Galeazzi. Very interesting thing, you all must have noticed that Galeazzi is called reverse Montegia, but Montegia is not called reverse Galeazzi. Do remember this.